installation of these kits at AdvoCap is a testament to our commitment to the safety and health of our community members. Our goal is to ensure that help is available when and where it is needed most. No one will ever be judged or questioned when the contents within the box is needed. It is important to me to ensure that everyone in need of Narcan because of an opioid overdose gets the help they need, no questions asked. If we can save the life of one individual, this project is a success. The installation of these kits is just one step in our ongoing effort to combat opioid crisis. We must continue to work together, support one another, and advocate for policies that address the root cause of addiction. Together, we can make a difference. I want to thank all organizations, volunteers, and community members who have made this initiative possible. Your dedication and hard work are truly commendable. I would like to personally thank Sue Fisher. Sue lost her son to an opioid overdose and has sponsored one of our boxes at AdvoCaps today. Thank you, Sue. Let us stand united in our mission to save lives and build a healthier, safer community for all. Thank you. I'd like to introduce Vance Henning from the City of the Fond du Lac Police Department.
Hello, my name is Vance. I'm a detective with the police department. However, I had the opportunity to work in our drug unit for 9 years, Lake Winnebago drug unit. Some of the things I noticed while working in the drug unit is the effects of good people, children, parents that are affected by opioids and by fentanyl. And I think it's a good chance and it's a great opportunity for our police department to show to the community that not only we're here to enforce laws, but more importantly, we're here to help people. And I think with Oaks and the opportunity to have Narcan available out to the community is a great step showing that the community is here to support those people that are struggling with fentanyl and other opioid type addiction. But I think the police department is also doing a good job working towards helping those that are struggling with these kind of addictions. So I myself has also joined a couple boards with Holly. She'll touch on that recovery that we're looking to bring into the city of Fond du Lac to help women and children that are suffering from different addictions. So with that, I'll bring up Holly.
I'm Holly Mulder. I have volunteered with SHN, which is Start Healing Now, and that's kind of in conjunction with the Oak Kits. So I've worked with Jess for quite a while. And I've also had the privilege of working in a treatment facility, a women's transitional treatment facility, just south of Fond du Lac in Eden. And kind of that's really what I'm here to speak about is my experience as somebody in long-term recovery, but also sort of having worked in that environment. And I, like Vance said too, I mean, we have gotten the business going, Araya, which is an adult recovery and youth alliance. We're just looking to sort of secure a property here in town so that we can get that up and running. But I mean, the concept of having safety is huge for me, and me personally, but also then, you know, in the working environments that I'm choosing to be in. So I'm 11 and a half years in recovery myself, and so there's been a lot of time to have stories shared by people in recovery, never mind my own. And I want to just touch and give you one example of a situation that I had in the facility that I was currently working at. Okay, so you think this is a treatment facility, right? There might be this thought possibly that, you know, there may not be overdoses there. It's a treatment facility, right? That's not the case. And, you know, I mean, not everybody is in the same spot coming into treatment, right? So I actually had an individual who just kind of noticed that she seemed a little off when she was in, and it was on her admission day. And, you know, it took I mean, this is training and experience, right? To be able to discern something isn't right. And lo and behold, she was ODing. And, you know, it was Sarah, who I'll introduce next. I mean, she had come from the health department and trained us at where I was working on Narcan administration, and thankfully she did. And we had that readily available in the home. And I had to use 2 different doses on this individual, and we were able to save her life. And that was, you know, that's having that on hand right there, right? And I mean, time is a factor. Time is a factor. And you can't move forward getting help, you know, seeking treatment of any sort, or moving away from that lifestyle and moving into a healthier space if you aren't there. So to give people that opportunity by using Narcan when it's available, and it's not just that. I also want to say too, with these OAT kits, you know, there's some spots in there too, and on some paperwork where there are resources available. I mean, so this isn't just, you know, multifaceted, right? So I mean, you have this piece where there's also something you can plug into where it gives maybe anybody that has dealt with a potential overdose. It could be the friend, it could be the bystander, it could whoever, right? And hopefully that person. But there are resources available as well, and I think that's amazing that that is coupled into the kits. So I'm personally really excited that these are going up in different locations throughout the town. I think it's great to see that where you live, right? I mean, we start to get this sense of community where we're at and we care. And when you've had experiences where you've seen the hard parts of some things and the realities of some things, you really come to know the importance of being able to save a life and potentially having something like that there. So with that, I don't know where Sarah is. I'm looking around, but okay, so there's Sarah. I will introduce Sarah.
Thank you so much, Holly, for sharing your perspective. It's important today because not everyone gets to see that perspective that you do and how much of an impact it can make. So, Sarah Gradigan with Fond du Lac County Health Department, and just reflecting some of the statistics for what we've been seeing in Fond du Lac County. In 2023, we lost 24 individuals to an overdose death, and these tragic losses we know continued into 2024. So by coming together like we are today, we can continue to fight fentanyl and raise awareness for the risk factors of an overdose, learn the signs of an overdose, and know the steps to respond. So through the Wisconsin Department of Health Services Naloxone Direct program, Fond du Lac County Health Department is able to provide Narcan and train our community no cost to that. So we're grateful to be able to participate in this program and encourage local organizations like ours to this life-saving community that will combat that we see towards addiction and connecting recovery. So overall, is the medication that's stopped inside the overdose, or commonly known as the name Narcan, that can reverse an opioid overdose. So it's important to know that because of the strength of fentanyl, that opioid multiple doses of Narcan may be necessary as Holly mentioned. So if you suspect someone's overdosing, call 911 immediately to make sure more Narcan is on the way. The Narcan that is stocked in the overdose aid kits is available at that is also available at our health department is a 4 milligram single-dose nasal spray. So each 5 doses of that. We have staff who are trained to provide education on how to use Narcan nasal spray and how to recognize the signs of overdose. If you'd like to schedule an individual or group training session for your business, your community group, or your nonprofit, please call us at 20-99-35. We also have a 5-minute training video that's available on our website, so anyone can watch that. In addition to the boxes that are called at WBAY today, we'll be installing a series of boxes throughout the community. So these locations include Brothertown Indian Nation, Rainbow Bridge, Beacon House, Holy Family Rain Shelter, Hope Lutheran Church, and Still Funeral Home. In addition to these locations, boxes is also available at your in Fond du Lac and Lighthouse Christian Church. There are additional locations for Narcan as well throughout the county, and you can find these locations on our website at www.flco.wi.gov. Also in the OATs are fentanyl testers. So these are legal encouraged to use this drug checking technology if they are taking any substances from a pharmacy. The reality is fentanyl in our community, and it's an opioid with extremely high potency. It's being mixed into drugs such as meth, heroin, and cocaine, and fake pills. No one may know will know it's there unless they test for it, and they may think they're using one substance, but it is another. So it's hard to detect. You can't see it, smell it, or taste it. And a tiny amount, as little as 2 grams of salt, is enough to detonate to someone. So in 2023, fentanyl was present in 87% of the overdose within Fond du Lac, contributing to increasing overdose death rates the last few years. So by coming together as a community like we are today, we can continue to fight, spread awareness, carry hope, and bring treatment and recovery resources to our community. So with that, I would like to introduce Jessica of this organization.
According to the Center of Disease Control and Prevention, 110,000 people died from overdose deaths and poisoning in 2023. In the time that we gather here today, 5 people will die in this country from overdoses. That's a death that could have been prevented from the use of naloxone. My name is Jessica Geschke, and I'm a senior project manager with the Clinton Foundation and the president of a Wisconsin-based nonprofit called Start Healing Now. I'm also an family member. My brother has been addicted to the drug heroin in the past and is now in recovery. I'm also a person in long-term recovery. This last March, I celebrated 20 years of long-term sobriety. I want to take a moment to thank Sarah from the Fond du Lac County and Brenda and Tanya from AVOCAP for meeting with me over these last several months, for listening to me share about our organizations and our missions and passions to bring Narcan and harm reduction measures and educational materials to the communities of Wisconsin. Thank you for hosting this event today and for helping save lives here in Fond du Lac. I want to thank Christine from the Sparkle Studio for meeting with us and being our photographer today. I'm honored to be here today to witness this creation, my creation, of the oak boxes come to life in Fond du Lac County. For those of you who don't know, this has been my life's work, and for the past 5 years, I have poured my heart and soul into this project for days exactly like today. So how did I get here? I had a goal of helping people, those who suffer with an opioid use disorder, get access to naloxone. I've always said one of the most important things you can do if you want to change the world is to survive long enough to do it. It has been my experience that dead people have very little influence on society. I began the implementation and creation of a project called the Overdose Aid Kits, or oak boxes, in 2018. Oak boxes are small metal boxes that contain harm reduction items such as naloxone, breathing masks, fentanyl testing strips, disposal X packets, education resources with our partners such as Song for Charlie and Safe Project, and information on where to locate resources. We are hanging them next to AED machines across this country. I started off with this small idea to get naloxone into the hands of people who need it most, and since 2019, we have flooded the streets of the United States with over 3,500 oak boxes. Right here in Wisconsin, with these 10 installs that we did today, we have surpassed the 900 mark of oak boxes in our state. Thank you. I get a little emotional about that because I never thought I would be here today saying that. So we install these oak boxes into public places such as hotels and music venues and coffee shops and gas stations, and homeless shelters, but also in employer groups and construction sites and high schools and colleges. This program, the Oak program, has been a game changer for those suffering from an opioid use disorder, but also for those who want to be a part of the solution. We believe that anyone, all of you, can save lives by making Narcan widely available within your businesses and communities. We think Narcan should be as easily accessible as a fire extinguisher. So how did the Oaks become part of the Fond du Lac landscape? 2 mothers here in Fond du Lac have experienced a profound loss. They turn their pain and grief of losing their sons, Kevin Fisher and Jacob Starks. The loss of these 2 men, their lives. They have taken their loss and turned it into helping others, and in turn found a powerful way to find meaning and purpose in the face of tragedy. They have achieved this by channeling their experiences into advocacy, support groups, charitable work, and other initiatives that directly address the issues of substance use disorders and overdoses that resonate with their loss. They have purchased the oak boxes that you will see hanging around the walls of the businesses in this community. These oak boxes are a gift from these family members in memory of their boys. I thank them for allowing us to help them provide comfort and understanding to others facing similar challenges. The Clinton Foundation encourages everyone here to get trained in naloxone, carry it on your person, and if you own a business, get an oak box today and help save a life. Thank you.
Do we have any questions for any of the speakers?
I know you guys mentioned that some of the locations for these boxes, but can you confirm how many exactly are being distributed across Fond du Lac, and how people need to go about accessing them when they need one at any of these locations?
Yeah, so today we are installing 9 oak kits throughout the businesses that I mentioned earlier, and then there are 2 existing boxes within Fond du Lac, and we hope to continue to add to that number.
As long as you're up there, you said that there were some signs that maybe you could address for what to recognize when somebody is having a poisoning or a
Yes.
situation.
Yeah, so the key signs that you'd want to look for are going to be listed on the cards that are inside the oak boxes. So troubled breathing is that key one, so slow or struggling to breathe. The person's unresponsive, so beginning to maybe nod out, not respond to any stimulation or yelling their name. And then other signs would include pale, clammy skin, loss of oxygen, so the pale skin with lips and fingertips turning blue.
Is there any way we can get a list of all 9 businesses that are participating?
Yes, we will have that available.
And also, how much does each kit cost?
So I will turn it over to Jessica, but $225, I believe.
Yes, $225.
Sarah, I was wondering, the products in the kit, do they expire?
Yeah, so the Narcan in there does have an expiration date at the top of the box, so it is listed. The kits are good for 2 to 3 years on there. So the kits that we're distributing today, I believe, have January of 2027 on there. And then as we restock them, the expiration date will extend as they're newer boxes.
Is it the health department that will be restocking them, and I guess, is it like a daily check, a weekly check, how does that?
Yep, so with each organization that we've installed at, we've handed them our business cards. They will monitor the box and reach out to restock when it gets low, and then through our Narcan Direct allotment through the state, we'll replenish the supply in there as long as it's available to us.
I know you mentioned the training for people who want to learn how to use the video online. How important is it for people, I guess, to go through that training, and if they don't or have an opportunity to do it, how important is it for them to still try, I guess?
Yeah, so the instructions are on the back of the card that they can take with the Narcan, and it's also on the Narcan box and the door of the oak box. The training video that we have available is less than 5 minutes, so it's quick, and all the steps are right there for you. The most important thing to remember is you're doing the best you can. You can call 911 and they can walk you through those steps as well in case the person's in shock of what they're witnessing, and there is help available.
And I will add to that too. The reality is also, even though we want everyone to feel safe calling 911, there are situations where, in certain situations, that might not be done or want to be done. And so the fact that it has now moved to a nasal spray, I think is really beneficial versus the injection form that they used to have.
If you just kind of think of how you would pump in a nasal spray, right? I mean, essentially it's that simple. Obviously the training is still really important because it walks you through maybe a couple other things you're gonna need to know. But if you were somebody on the street, somebody just not have had maybe taken that training, what is on that box, any of the Narcan boxes that you would get from anywhere, right? Or out of the kits, it is pretty simple to follow. Yeah, just wanted to add that.
If you accidentally, let's say you went through the card and they had those symptoms, but it was some other issue other than an opioid, would that cause them harm?
No, no harm. It's very safe to use, so it's only effective on opioids. So if the person's overdosing from another substance, it's not going to help in that case as well. If it's a different medical condition, it's not going to help that, but it's not going to hurt either. So it's safe to use, so that's why it's so important that it's accessible, because there's no negative side effects with that.
The CDC's got they track overdose deaths by the month, and it looks like, through July, nationally overdose deaths were kind of trending downwards. I don't know how much you can get into if we're seeing any trends in 2024 at the county or at the state level. Do we know anything about how things are trending last year, I guess?
Fatal or non-fatal overdoses, were you specifically looking at one? We have no confirmed numbers for 2024, but I believe the preliminary numbers are lower, but I can't speak to that to confirm anything. But I know nationwide, I believe they did see a decrease for the first time.
We'll add too, locally, I don't have the memory on the numbers here, or the data, or the stats, but I know we have seen an increase locally in our homeless population, and so, unfortunately there just is a tie to substance use disorder. Not with everyone clearly, but there is in that capacity, and so, I mean, even if maybe the 2024 trend was trending down and we're also seeing maybe an increase in homelessness, it kind of you have all these little factors, but at the end of the day, even if those numbers were going down, I mean, looking at locally, right, I mean, there really could potentially be some more situations at hand where, it is just as important then to have, right, I mean, this stuff available.
I'm guessing the goal of these boxes is to make it easy to distribute across the community, so if somebody thinks they might need one, they can come and get one at any of these locations. Because obviously when an overdose is happening, you never know where it could happen or where that would be. So I'm guessing this is just a distribution kind of thing.
To make it as low barrier as possible to access, rather than someone calling the health department, coming up to the third floor. It's out in the community, and it's accessible for anyone who's at risk of an overdose or knows someone, a family member, a friend. Those are the people that we'd like to reach who are in a position to witness an overdose or know someone who's really at that high risk moment. So absolutely.
I have a follow-up question to the statistics story about nationally the numbers kind of coming down last year. Overdose deaths, or is that a separate category, considering the person didn't necessarily know that they were, going to lose their life because it was fentanyl included in the drug?
Fentanyl would be included in the overdose deaths for drug overdoses, correct. Some of our county data were able to disaggregate to know that 87% of the losses in 2024 included fentanyl in there. I don't know nationwide that statistic off the top of my head for the last year, but it would be included in there.
Do you know, as far as fentanyl specifically goes, what the picture is here in Fond du Lac County? Is it getting worse?
Yeah, I might turn it over to perhaps our police department if they can answer any of those questions.
Sure. I would say, speaking of the overdose deaths, I can say that based on the cases we've got, I think the overdose deaths has probably been down last year compared to 2023. We've seen a decline of it. I do know that a lot of fentanyl is what's being sold on the street as heroin, so people are thinking they're buying heroin, but really they're buying fentanyl, and they don't realize that. Because of the potency of fentanyl, that's kind of part of the problem, is they don't realize that. And they might have saved a relative in the past with a certain amount of Narcan with a heroin overdose, but they need a lot more for fentanyl. So sometimes they use that and they try and it doesn't work. Usually we get contacted and respond, but I think that might be part of the reason why the numbers are down, which is good. I don't know exactly why that is, but I do know our drug unit, when it comes to purchasing drugs, they're still buying a lot of fentanyl that's supposed to be heroin, or that they're selling as heroin. So why that is exactly, I don't know. I mean, I'm guessing probably wherever the drug source is trying to sell it as heroin, and maybe fentanyl's cheaper. I'm not quite sure on that, but I do know they see a lot more fentanyl as opposed to actually heroin that they're buying right now.
I think the fact that you guys are spreading them all around the community, I mean, to somebody who, isn't from this community, it just seems like, is there a reason why you were putting so many boxes out and kind of saturating the community on this day?
And I think it's a great thing to do because people don't always realize, like when I would talk to people, I talk to grandparents of kids that use, and they're like, if they're accessible, I'm going to get it because I know my grandson uses. I mean, it's not uncommon for parents to get it if they have a kid that uses or a loved one, but I think it's great that other family members also get it just in case, because you never know when that person's going to visit and might use, unbeknownst to you, an overdose. So I think they're great to have almost in every house because you never know when someone's going to come over and might be using drugs, you might not be aware of it. So I think that's another benefit of saturating the whole city and kind of putting it everywhere out there so it's accessible for people. And like I said, people that might not have thought about it or didn't know where to get it, now they know where to get it. And it's easy for them to get and have it because you never know when you might need it.
And also just even isolating the recovery community, not to whatever, but I mean, there are a lot of people in recovery. And there are a lot of people in recovery in Fond du Lac as well. So kind of to answer that as well, the reality of being in recovery is there are relapses. And so when someone goes a while without using a substance and then relapses, a lot of times their bodies can't handle, right? Or even their sources are different. And so you don't know what you're getting. So to be honest with you, I don't use anymore. I'm in long-term recovery, but I have Narcan with me because I don't know. I don't know who I'm gonna encounter that, I may have a little more, frequency in communication with people in recovery. You never know. I mean, so often do we hear in recovery that we never saw it coming when somebody relapsed. Sometimes yes, right, the signs can be there, but there are times where that is absolutely, it blindsides you. So to be able to have that available, just even within that segregated piece of our society, right? Never mind the many that aren't in that environment as well. Like Vance, you kind of touched on that, but.
And then, I guess, like there was an opioid crisis like before the pandemic, but it looks like in 2020, that kind of just put everything on like an upward trajectory. I guess, does anyone want to just kind of speak to just kind of the effect of the pandemic and like that isolation and just kind of why we saw numbers kind of increase during that period?
Well, I guess, Sarah, do you?
Yeah, you can go ahead.
Okay. So I have to go. Just kidding.
Sorry.
I'm only going to touch on one piece of that. I'm not sure some other pieces, but you look at, I think actually you might have mentioned it, Tanya, in what you were saying in the beginning, something about like the root cause of substance use or addiction, right? And we look at how trauma is associated with substance use disorder, okay? So now picture in the pandemic, and you're talking about the isolation. We know with the science of the brain, the science of addiction, isolation is one of the things, okay? So it's one of the things that will add to maybe not good mental health, okay? So if you're already predisposed to, a substance use disorder, or maybe not, and maybe this is just all those pieces and ingredients being all the right place at the right time, so to speak. It's really not, but you know what I mean. That had to be, I think, a tremendous factor is the mental health piece to that, because not everyone, and we know this, I mean, this room isn't totally large, but I'm pretty sure, including myself, I can pull some people out of this room that knows what that did to their mental health, okay? And we found ways, we navigated, we're humans, we're resilient, right? But at the same time, if you're wired in that predisposition of substance use, and now you have any social connections in person, I mean, granted, we did eventually move to things like, virtual this and Zoom that, which is great, okay? But there was a period of having to figure this out. And it's still not the same as being with your people, okay? Or even physically being at work. Some people lost their jobs. I mean, so now you have, right, all these factors of, changes in your structure and your routine. That's huge in recovery. So even in the treatment, dynamic of all of this, just speaking from that, those are the pieces that we try to do with like lifestyle skill changes. It's literally everything. When you look back at the pandemic, it's funny because it's all those pieces that we're actually, and not because of that. I mean, this has been kind of a baseline for treatment for a while, and then you bring in new data and you adjust, right? But from research. But I do think that it's that mental health piece, isolation, changes in structure and routine are huge. And then, yeah, I mean, you just think of how you feel when you have any loss, whether it's a person or not. I mean, it could be a job, it could be your life. I mean, just your livelihood, right? That's if you don't have those coping mechanisms in place, and everything kind of went not in person, right? And we had to refigure it out. That was, I think, a huge factor. But I don't know if Sarah or Jess have anything to add to that. I don't know.
I think you said it well.
Oh.
And we've got about 5 minutes left, so 2 more questions.
You don't want, you prefer people who know somebody or think that they might be dealing with an overdose to visit these boxes, right? As opposed to, or do you want everyone in Fond du Lac to come get one?
Yeah. I guess I would say, yes, if you're interested in taking that step and you know maybe even someone that you'd like to give the box to, that is what they're there for. If you'd like to have more of a conversation about it, you can call us, you can schedule a training. If you're in a more rural part of Fond du Lac that would like to host a training, we're happy to come out there and have that conversation and make them more accessible.
Sarah, besides the box, which has multiple ways of helping people can get an individual little kit to carry with them, correct?
Yeah, so the kit we generally refer to as the box.
Yeah.
And then we complement it with some CPR face shields, our recovery and treatment resources brochure, and then the fentanyl test strips, if that would be something they'd be interested in, and then the training card.
Are you able to quantify the success rate of communities that have boxes? Or is it?
Yeah. So I think, so first I just want to make sure everyone understands that this box will be nailed to a wall, right? Okay, so in 2018, the reason I created this was because I was shamed and had so much stigma placed on me because of my loved one's overdose, right? And so I had no one that came up to me and asked me if I needed more Narcan. No one asked me how I was doing. And these are medical professionals in an ER. So I went back to the drawing board and said, if this is happening to me, someone who represents Governor Evers on SCAOTA, which is a board in the state of Wisconsin, someone who has access to state legislators, right? How are the general population getting naloxone? I didn't understand it. I couldn't figure it out. So that's why I went to work and created these boxes so that we can hang them everywhere. I want anyone and everyone to have Narcan on their person. This should just be like a Band-Aid in your purse, to answer that question. Everyone should be carrying Narcan. This shouldn't even be a question of should I have Narcan. Yes, you should have Narcan. It should be in your purse. It should be in your car. It should be on your person at all times. End of subject. What was the next question? I'm sorry. I get on this pedestal thing and then I just quantify. Yeah. So when we reach out to communities and we put these out, I'm one person that runs the Overdose Aid Kit program within the Clinton Foundation, and I'll email them, and sometimes they write me back, sometimes they don't. I typically hear about the success rates. So we do have, especially in Wisconsin, we have oaks that are on walls where people have overdosed and they've pulled out the Narcan and they've used it to revive people, and now they're alive today, because of that reason. We've had that happen in Madison multiple times. We've had that in Waukesha. So I can't give you like a number of how many people have been saved because of the oaks, but I can tell you that they are working. We also have people replenishing the overdose aid kits. Like we have one place, in Las Vegas where we put up an overdose aid kit, and within the first week they had to replenish it 6 times. They went through 724 kits of Narcan in a week because people just kept coming and taking the Narcan out. So in that case, I know it's working because people are taking the Narcan and they're at least having it either on their person in case that happens, or they're using the Narcan because someone's overdosing that they're using with. Either way, lives are being saved. Did that answer your question? Yeah. Okay. Anyway.
One last question.
Is there a locator for where the boxes are?
So it's www.starthealingnow.org. We have a heat map, and you can locate it. It is not up to date. I'm just going to put that out there. We're all volunteers for Start Healing Now, and so I have to go in and update the map. But I need to get that done. So if anyone's a person that does what is it called? Websiting? Hit me up. But yeah, so we do have to go in and update that map, but it is on there. If you want a full detailed list, I have that on a spreadsheet on our computer, and so if you want like certain areas or sections, you can just email us and we can get that to you.
Is it pretty typical to have this many in one community?
Yeah, we have, Waukesha County has 250 of them. Dane County has 200 of them. Fond du Lac, it's on its way. We have I don't even know, Amy's in the back with me. She probably has more numbers in her head. She's got numbers, but we have tons of locations in Wisconsin that have clusters of boxes all over the place.
Awesome. Thanks, Josie. And then we'll